Hi everyone, it's Ashley. It's about 4:15 on Thursday. I am soaking wet because it's like a torrential downpour outside and I kind of got caught in a little monsoon. So as you can see, my hair is very wet and yeah, I'm kind of like a drowned rat right now, but trying not to be vain. So the old me would have canceled or postponed the chat. I decided not to, but if you're wondering why my hair is soaking wet, it's because it's pouring like a nightmare outside. I have also just been having one of those days. I haven't felt well all day, so I went to a meeting over coffee and then lunch with my friend with no makeup and wet hair, and you know, it is what it is. So I'm being real here. It's a very rainy day, which is probably also why I'm not feeling well, in addition to not looking my best either. But welcome to the live chat. I didn't want to cancel it just because of a little rain or because of not feeling well. So here I am. Life goes on despite the weather, despite how we look, and despite how we feel. So I'm here with you today. I don't know how long I will be on the chat, but honestly, I'm in a parking lot. I don't feel like driving in this mess, so I have to wait for the rain to pass a little bit anyway. There's a definite risk for flash flooding right now. So I don't mind sitting here for a second. I had to run in the pet store. For those of you who don't know, I have 3 dogs, 2 cats. They're very spoiled, and after my meeting and lunch with my friend, I had to go treat them a little bit. Probably spent a little too much, but that's okay. I think fur babies are allowed to be spoiled. So hopefully today I get to see some of your comments. The last time I did a live chat, I wasn't able to see the comments, and I'm not sure why. The first time I did one, I was able to see questions and comments. The second time, I was not able to see the comments until afterwards. So if any of you would be so kind as to leave me a comment or a question now so that I can see if that's working live or not, I'd really appreciate it. And as usual, I will answer any questions you have or respond to any comments that I see pop up while I'm on the live chat. And then if they don't show up while we're live, then I will take the time to respond to them afterwards. So I'm just waiting for some comments and questions. But until then, I was trying to think of a topic for today. Other than me just sitting on here complaining that I don't feel good today. So what I wanted to talk about was the TV show, The Shahs of Sunset. For those of you who don't know, Shahs of Sunset is on Bravo. It's one of Bravo's lovely reality shows where rich people just fight with each other, and it's entertaining. On Shahs, one of the cast members named Gigi, her name's Golnesa. I'm not going to pretend I know how to pronounce her last name, and I wouldn't want to insult her by trying to do so and butchering it. But her name is Golnesa, known on the show as Gigi. She has rheumatoid arthritis, and it's been kind of a primary storyline this season and last, but particularly the current season. And she, from what I understand, does Rituxan and methotrexate, and she had mentioned in one of the previous episodes that she was doing chemotherapy for her RA, and she's very vocal about her RA, and she shares a lot of her journey on the show, but she faces a lot of scrutiny, and she has admitted to kind of self-medicating through alcohol use and partying, which of course no one condones. Sorry, I have a hair stuck to my lip. That's what happens when you get poured on outside and everything's a mess. At any rate, sorry. So professional, I know. Anyway, so Golnesa kind of struggles with her RA, And through the course of the show, we're now seeing that some of her friends don't believe her. They don't believe that she has RA, and they don't believe that RA is bad enough to where you would need chemotherapy. Their reasoning for questioning Gigi is simply that she doesn't look sick. She doesn't act sick according to what they believe, you know, a sick person should act like. And she still goes out and has fun and whatever. And like, I get what they're saying, that, you know, they're looking at it like, well, if she has such serious health problems, you know, why would she drink and smoke and continue to go out? I get that. But at the same time, it's that kind of thinking that really stigmatizes those of us with these types of illnesses. I understand that a lot of us don't look sick necessarily. A lot of us still try to live a normal life, and that can really confuse some people. And, you know, Golnessa, known as Gigi on the show, still likes to go out, and she kind of parties a little bit, and, you know, to each their own. She wears heels. I mean, I wore heels for as long as I possibly could. I wish I still could. Sometimes I will wear them still when I know I'm going to be sitting for a long time, or I'll wear wedges or some adaptation of heels since I can't do stilettos or high heels anymore. But she gets criticized for that, and no one believes like that she's actually getting chemo. And the one character, Reza, I think it was, or else Shervin, one of them said to her, or said to one another, like, I can't believe she's saying that she's getting chemo for her RA. Chemo's serious. And I kind of just thought to myself, obviously they don't know anything about RA, because RA is serious. Yeah, it's not cancer, thank God, but that doesn't mean it's not a serious illness, you know, and that's something that I talk about in my book, Chronically Positive, and I think I probably touch upon that issue in Sick Idiot as well. You know, and I also have a blog post that's been sort of widely received and widely read that you can look up on the arthritisashley.com blog, and it is about the use of the word chemo in describing your RA treatments and how it can sometimes be controversial. You know, I used to be really hesitant to use it, and I've since readjusted my stance on it. I think that as long as you're using the term chemo properly and not trying to mislead people, then of course, by all means call it that, because some of the treatments, not all, but some of the RA treatments are chemotherapy. Rituxan is a chemotherapy drug. Methotrexate is a drug that is at times given for cancer in a much higher dose, but it is given for RA as well. I wouldn't call that chemo, but I would have no problem in saying that it is a drug that's also used to treat cancer. Rituxan, again, is actually a chemo drug. Where it gets blurry to me is other biologics, you know, and I think that might be a regional thing. It seems to me that in the UK and some other countries aside from the United States, that some people are more open to using the term chemotherapy in regards to all biologic treatments. Now, in the United States, there's a little bit more stigma surrounding that, because a lot of the biologic treatments aren't actually what the widely accepted term chemotherapy is, and that would be, you know, drug infusions that are typically associated with cancer. Now, technically, the term chemotherapy is any kind of chemical or chemically altered drug that's entering your body, and that could really essentially be any medication. But the reality is that, you know, most people associate chemotherapy with cancer. So you have to be really careful how you're using that term. And I think what bugs me about it is not the use of the term, but sometimes people's intentions surrounding it. So some people with RA, and I'm not saying all, I'm not even saying most, but some people with RA will use the term chemotherapy improperly or kind of with the wrong intention, just to garner sympathy or pity or what have you, maybe just to try to garner attention. And I think sometimes people do it without malice, like without malicious intentions. I think some people use it just to kind of reiterate how serious RA can be. and kind of shed some light on that. But I think that people have to be careful on how they're using the term chemotherapy, because using it the wrong way or the way that's not really socially acceptable could actually further create a negative stigma against RA patients and kind of make it seem like we are faking or wanting attention. So I would just be really careful how it's used. When I was on Rituxan, I did call it chemo because it is chemo, but I wouldn't call like Enbrel or Remicade chemotherapy, because technically it's not. And I talk about this in one of my blog posts that you can certainly look up. I just want to be certain that when people are using that term, they're using it correctly. And yeah, RA is serious, but it's not cancer. And when people try to link the two in a misleading way, it can set back our intentions to try to get people to take us seriously, because then it can look like we're lying or just seeking attention. So I would be really careful to be comparing RA to cancer and be comparing, Remicade and things like that to cancer treatments, because they're not. In Gigi's case, however, on the Shaws of Sunset, which is what sparked this topic, she is using the term correctly. She is on a chemotherapy drug. Rituxan is a chemo drug, and the dosing is actually similar for RA patients and cancer patients. It's just administered differently. And she's also taking methotrexate, which, as I said, can be given for both cancer and RA. It's just dosed very differently, and that's something to keep in mind. I read somewhere that the dose of methotrexate that RA patients take is like 100 times less potent than that of what cancer patients take. So I just want to be careful when I talk about it, and maybe encourage other people to do the same, that you differentiate where it's appropriate to differentiate, and to make sure that you're not purposefully or even unintentionally misleading people. So in Gigi's case, she's not. She's using the term chemo properly because, as I said, Rituxan, chemo drug. Methotrexate, yeah, I mean, it's a stretch to call it chemo, but it is sometimes used to treat cancer. But when I hear other people using the term chemotherapy for RA, it kind of rubs me the wrong way, because a lot of times what they're taking is not. So, and maybe again, that might be a regional thing. I think maybe in the UK or other parts of the world aside from the United States, chemotherapy, that term might be used differently, but here, it has a really strict connotation associated with cancer. And having known people who have suffered with cancer and or died from it, it's not something I take lightly, and I don't want to mislead anybody. I think that does us a disservice when we are talking about our illnesses. Yes, cancer and autoimmune diseases have a lot in common. There's a lot of overlap as far as symptoms and treatment, and even the biological mechanisms behind the illnesses, but they're not the same thing. And I think it's important for patients to remember they're not the same thing, and to treat each set of illnesses with respect. They are different, but as I said earlier in this chat, just because RA isn't cancer doesn't mean it's not serious. So, there's just a lot to think about when trying to contrast and compare those conditions, and also when discussing the medications and the use of the word chemotherapy. So I just want to caution people to kind of be careful with how they're talking about their treatments, and make sure they're using the right words as to not confuse or mislead people. Now, I am seeing that there are comments, so I'm glad that they're actually coming through this time, because last time I wasn't able to see them. So hello to Christy Staley. Nice to see you. Thanks for hopping on the chat. Hi, Nigel. Nigel says he has psoriatic arthritis and gets 3 to 4 migraine type symptoms per week, sometimes lasting 2 or 3 days. He finds that heat on the neck and temple area help a little, and he's spending a small fortune on a chiropractor. I feel you there, Nigel. I also get chronic migraine. I do not know if my migraines are related to my RA. I had a brain herniation called Chiari malformation, And I had brain surgery and neck surgery for that in 2011. I thought that might help my migraines, just like I thought that my celiac diagnosis and going gluten-free might help my migraines, and neither one of those things necessarily did. My migraines are triggered very much by weather like this gross weather that we're having now, and they're also triggered by stress and certain fragrances. So they've been really hard for me to manage. I do find that the Botox treatments help, Nigel. I'm not sure if they're available for you, if your insurance would cover, where you're located, but the Botox for migraine injections are great. They are typically only for people that have what is classified as chronic migraine, which is what I have, and that means you get 15 days or more with migraine symptoms per month, which is awful because some people, never get a true migraine in their lives. So it's really hard, but the Botox does help a little bit. There's also something, Nigel, called a Cefaly headband, C-E-F-A-L-Y. It's kind of expensive. Insurance does not cover it, but it's a headband that almost is like a TENS unit on your forehead, and it kind of does something with, I think, your... I can't think of what it's called, but it's a nerve that kind of runs through the sides of your faces, your trigeminal nerve, I think it is, and it stimulates that, and that helps a little bit. Nigel, also essential oils. There are some essential oils that I use and I sell that are amazing. One is called Past Tense. It's from doTERRA, and another one is called In Tune or In Focus. I would have to check the name of it when I get home. Lavender, there's a few other ones that kind of help with migraines. So if you'd like to try any of those, another one is Deep Blue Rub that helps for migraines and for muscle and joint pain. So if you, Nigel, or any of you want to try any of these essential oil or essential oil based products, let me know. I will give you that website at the end. They have worked wonders for me. And so has chiropractic, massage, and acupuncture. So I do a combination of these things to manage my migraines and my dystonia, my RA, and some of my other conditions. So yeah, but Nigel, I agree with you that heat works wonders. Some people like ice, and I prefer heat on my neck for migraines. But I sometimes do heat on the neck and then ice on the temple or on the forehead. So thanks for that, Nigel. And again, just in case some of you are tuning in late, the reason my hair is soaking wet is I got caught in a torrential downpour. I've kind of been looking a hot mess all day today, but I don't usually look like such a drowned rat. It's just really rainy and gross here in Pittsburgh, and that's kind of probably why I feel like crap this week. So hi, Andrea Andrea, I'm not sure. I hope I'm pronouncing your name right. It's great to see you. Andrea, you asked what I'm taking for my RA. It's funny you should ask. I've taken almost everything that you can take. I've done, I've done Plaquenil. Plaquenil caused permanent blind spots in both of my eyes called bullseye maculopathy. So I'm no longer able to take Plaquenil or anything in that class of drugs. I've done methotrexate. I've done, tons of different DMARDs and NSAIDs. Currently, I'm taking a combo of azolfidine, which is also called sulfasalazine, Celebrex, and I'm going to be starting Enbrel back up soon. Long story short, I've been off and on Enbrel for years. In the winter, I got a really bad lung problem that doctors couldn't really figure out. My small airways were spasming. Basically, I got a random asthma COPD type situation pretty badly, kind of out of nowhere in like November, December, January. And it lingered for like a few months and nothing really helped it. So I stopped the Enbrel and, it kind of went away. But my rheumatologist said the only way to tell if the Enbrel caused the breathing issues is to go back on it again and see if it happens again. But it's really scary not to be able to breathe, so I kind of don't want to try it again. But as my rheumatologist likes to remember, or I should say remind me frequently, I'm running out of treatment options, and this is very frustrating. A part of this is because technically, in his eyes and in his files, my diagnosis is SJIA, which is systemic juvenile idiopathic arthritis. I got diagnosed at age 10. It's the polyarticular form, which means it's systemic and I have it in all of my joints. Most other rheumatologists and doctors I've seen have also diagnosed me with RA, like adult onset RA. He's my primary rheumatologist though, and he won't add the RA diagnosis formally. So it has really limited my treatment options, and I'm not able to get certain medications because they are only approved for RA and not SJIA. So I'm kind of between a rock and a hard place there. But I want to continue working with him for as long as possible. He's been my doctor for 22 years, and so I don't really want to switch, but it's really limiting my treatment options. So that's a little frustrating. So yeah, right now I'm doing the azolfidine Celebrex, and we'll probably start Enbrel again. I also take Valium as a muscle relaxer, and some other things as needed. I use Deep Blue Rub, which is an essential oil-based product. I use that topically in my muscles, and I absolutely love it. And there's some other therapies I really want to try when they become available here. I'm not at all opposed to medical marijuana. I will be trying medical marijuana when it becomes legal here. And also stem cell therapy. I really want to try stem cell therapy in my knee and my foot. But in the past, I have been on Remicade, Orencia, Humira, Imuran, Enbrel, Rituxan, methotrexate. The list goes on and on. I've tried some narcotics and opioids. I rarely ever take them. I don't like them. I've tried Flexeril as a muscle relaxer, a ton of different things. So, so you asked what I was on right now for my RA, or maybe you were asking somebody else, but I answered. So yeah, that's where I am right now, and I just told my friend at lunch today I haven't been great about practicing what I preach lately and staying on top of things. I've been having a few petulant child type days where I'm over it. I don't want to be going to doctors anymore. I don't want to be taking meds anymore. It's really irresponsible, but I've just kind of been in that place lately where I'm so sick of dealing with all of this, that I needed a little break. Interestingly, and I'm not trying to push or promote any kind of lifestyle or treatment regimen at all. I want to make that clear. But I will say this, the only time that I've ever been in remission in my adult life has been when I went almost completely holistic and natural. I worked with a translational medicine doctor in Washington, D.C. Translational medicine is sort of like functional medicine. It's like an integrative approach where they look at the patient's whole body and their whole set of symptoms instead of just cherry picking. And he actually is a rheumatologist. I mean, that's his background, but he practices translational functional medicine. And I did really well under his treatment plan. And I actually went into clinical remission, and symptom-wise, I went into remission. So I wasn't having any RA symptoms, and also all my blood tests were normal during this time. It lasted for about 1.5 years, and I kind of made, I guess, the mistake of getting scared into going back on an RA drug. I don't want to say which one because I don't want to make it sound like I'm dissing anyone or anything, but I went back on an RA treatment, and everything went downhill from there. So it's been a struggle since then to try to get back to that really good place. And, again, I don't tout or promote any specific drug or lifestyle. My only advice is that you find what works for you, and whether that's all natural or that's all pharmaceutical, whatever works, do it and stick with it for as long as possible, because a lot of these treatments, people try them and fail. And so it's really important that you do whatever's working for you. We are all individually unique, and what works for me may not work for you, and vice versa. And these conditions lull and flare and ebb and flow, and a treatment might work for a few months or a few years and then fail you. So it's all trial and error. You just got to work with your doctor, but also educate yourself and trust your gut and listen to your body. There are new things in the pipeline. I don't know if you guys follow me on healthline.com, but I just posted yesterday a healthline.com article. I will continue to repost it this week. It's about a new drug that is in phase 3 of clinical trials, a new drug for RA, being put out by a company called R-Pharm. That's R-Pharm, and they're based in Russia. This drug is in phase 3.